Professor Burns, the World Health Organization were very specific in early March in calling on countries to test, trace and isolate. Why did some countries move away from that approach?
Well, I suspect that some countries didn't do that because they didn't have the resource, they didn't have the setup. And it's even possible that some countries didn't understand what they were supposed to be doing. So I think the UK possibly falls into that latter category.
But surely public health was to a great extent in terms of the control of infectious diseases pioneered in the UK and in Scotland. So what on earth happened?
Well, certainly, one of the classic tales of tracing infectious disease was the famous Broad Street Pump episode in 150 years ago or thereabouts, where cholera appeared in London, and because they mapped where it was occurring, they were able to work out what was causing it, and they were able to shut it down. And that's a classic example of the test and trace approach. I suspect that the UK government's approach to this was determined by the fact that they just did not have the capability of testing enough people. And other countries were quite innovative in doing it. For example, you saw pictures of people coming off aeroplanes in South Korea and Singapore, and they were having their temperatures checked using infrared technology. We've not even now started to do that. We've still got people coming in on aeroplanes and not being tested in any way. So I think we just didn't get to grips with the concept, and we didn't apply the technology fast enough.
But surely most university laboratories and many businesses would have the sort of laboratories that could quickly be utilised into a tracing regime for a virus whose identification has been spread across the world.
Absolutely. Most universities will have the PCR machines and so on in their biology and biochemistry and pharmacology setups. The problem, I think, was the chemical reagents needed to do those tests to extract the viral RNA and prove that it was COVID-19. And in part, I think, the UK chemical industry has kind of disappeared. We used to have one of the biggest companies in the world in ICI and so on, and many years ago that was sold off to, I think it was a Dutch company. Having all the reagents and all the necessary chemicals, I think, slowed this down. Several weeks, 6-7 weeks after lockdown, we only just now may be getting close to having enough testing capacity. And that's frankly not good.
So this week the UK and indeed Scotland have announced a return to the test, trace, isolate strategy. How difficult will that be now that the virus has a substantial grip, even if the peak is passed, according to the authorities?
It means you have to test an awful lot of people. We have to know just how much of it's out there to have any idea as to how safe it will be to lift the lockdown. UK government's boasting that it's done 100,000 tests the other day. I don't know if they've managed to maintain that or whatever. But if you think about it, we're a population of 60 million people. And if we were doing 1 million tests a day, that would be a couple of months before the whole population was tested. And by then you have to keep testing to make sure to see if it has spread within the group who were negative the first time you tested it. So we need to ramp this up quite considerably. We need, I think, to be sure that if we are going to allow some segments of the population to go back to work and so on, we need to make sure that they are all being tested before they go into go in and mix with colleagues and this kind of thing. So we need to make testing quite a routine thing, and it's far from being a routine. I mean, just to scare you a bit, some of the stories I'm hearing about people with clinical disease that suggest they have COVID, they go to one of these hubs that they're referred to where doctors are wearing all the full PPE and so on. They're told they probably have it. They're sent home to isolate in families where there may be other members of the family and so on that they're mixing with, and they're not tested. It's lunacy. And I'm seeing that, I'm hearing those stories from GPs and from other colleagues, and we just don't seem to have a grip of what we need to do.
How useful will the new app, this smartphone technical device, be in assisting to create an effective tracing and isolation regime?
It's important. I mean, in essence, the social distancing is, in effect, it's a kind of lockdown. It's not mixing the way you normally would. And as we begin to ease that lockdown, we're going to have to find ways of determining who people are interacting with when they are then tested positive. And this app, again, it's an app that seems to have been in use several weeks ago in other countries. And eventually we're getting to the stage where we're going to be able to use it. And I think it's going to be very important. It's kind of virtual lockdown, if you like, being able to do a number of things like wear masks, know who you're interacting with and so on. It's a way of moving us away from lockdown and still providing some certainty that you will be able to trace and isolate the people who are acquiring the disease. So I think it's important that we all use it.
But however assistance is given by technology, presumably you still need the personnel who are conducting the tracing organisation. You still need the boots on the ground. You still need the people manning the phone banks. What sort of professions do we have that can build up that army of people? And in Scotland, have you any concept of how many people will be needed for an effective tracing policy?
Well, the obvious group of people who are not being talked about quite so much just now, but would be very good at this because this is often what they get involved in, are the environmental health officers who do trace individuals who've perhaps come into contact with risk situations. EHOs, I think, would be important, not just in doing this, but helping to train in other professions to supporting the tracing effort. I don't know if discussions with the Environmental Health Institute is taking place, but it should be. We can do this. We have to do it. We have to begin to move back to a point where economic activity slowly but safely grows. And we have to do it this way. Test, trace and isolate is an alternative to the existing lockdown, which means that everyone is effectively isolated. We've got to begin to do this safely.
Professor Burns, you're Professor of Global Health at the University of Strathclyde. Casting your eye internationally, which countries have impressed you with their approach to handling the virus?
Well, there are many. I think South Korea, because of its experience with MERS, was prepared in a way that we clearly have not been prepared. I think Germany moved very rapidly. Discussing, as I did last week with a group of German colleagues, their response, they're taking the view that Germany's getting a bit of undeserved credit. They think Germany could have done more, but they've still kept the death rate down very, very low. Austria, Switzerland, these sort of places have managed this in a way that we clearly have not. And that's a sign that we just have not got to grips with it. Now, Germany started the testing regime very early and were able to manage this much more effectively, I think.
Is one of the lessons thus far from this global pandemic to stress the importance of public health, which has to be regarded as great a priority as the managing the acute treatment of such a serious disease?
Oh, absolutely. I mean, I think, again, commenting about government, and by this I mean the UK government again, I think they were terrified that the health service was going to be overrun, and quite legitimately. I mean, I speaking in early March to colleagues who work in intensive care in London, they were really concerned that they were going to be overwhelmed, and at the beginning they very nearly were. I mean, they really were stressed, but it quickly began to be clear that in most cases things were manageable. I think that focus on protect the NHS was important, but we should be protecting the population as a first step. And protecting the population is all about understanding how this was spreading. And we knew a lot about that from information that was coming from other countries that had this before us. We knew it was very, very infectious. We knew a lot of people would be out there capable of spreading it, but would not necessarily show much in the way of symptoms. And we just did not early enough start to test and trace and isolate. And as a result, we have had to have lockdown that's gone on for several weeks.
Harry, should anybody be particularly surprised that poverty and deprivation are proving to be such a marker of those who are most impacted by this dreadful disease?
We shouldn't be surprised at that, because early on it was clear that people with coexisting illnesses were at greater risk of serious complications and death. And the lower down the social scale you go, we have known for many, many years, the poorer your healthy life expectancy is. Mortality is higher, the lower down the social scale you go, but the number of years you spend with coexisting illness is greater. So people in their 50s who come from poor backgrounds are about as much less healthy than people who come from affluent backgrounds and in their 50s and 60s and 70s even. So that additional problem of chronic ill health is a real issue here. The other aspect to this that's important is the black and minority ethnic groups that seem to have this more seriously. And that is probably a bit more complex and not entirely clear that folk have worked out what's going on there yet. But there is no doubt about it that as far as Scotland is concerned, people at the lower end of the social scale are having much more serious illness. And the other thing is that because people with other diseases, other illnesses, but without COVID, are reluctant to go and get attention for their problems, they're probably at an increased risk of dying from other causes, not COVID, because they are not seeking attention for acute problems. So it's really hitting them in two ways.
Harry Burns, you're speaking to us from the great city of Glasgow, where it's sometimes been noted that even just a few miles apart, because of economic factors and deprivation, there can be dramatic differences in longevity and life expectancy. Do you suspect that when we come to analyse the impact on mortality and COVID-19, we shall see the same disparities on adjacent populations?
I don't think there's any doubt about that. This will have an impact on health and mortality inequalities, that we will see a reduction in life expectancy in Scotland as a result of this. And the biggest reduction in life expectancy will be at the people at the lower end of the social scale. But that's mathematics that we will have to do as part of the review of activity when this is all done and dusted.
Harry Burns, are there any grounds for optimism that when we emerge from this crisis, that some of the public health messages that have successfully been got across will actually impact in a positive sense in long-term health?
I think the benefits that we will see, funnily enough, will be in the way in which our economy grows. People are looking to local businesses, they're helping them out. The local businesses are doing deliveries and they're starting to keep things going themselves. And I think after this, we will begin to show a bit more care and attention in terms of our own local community action. Inclusive economic growth is a policy that the Scottish Government wants to pursue, growth that includes everyone, affluent and deprived, not just the wealthy who can invest in big international companies and so on, but investing in local people, local enterprise, and keeping the money going in local communities. And I just wonder if there will not be an interest amongst people in Scotland in doing more of that, in supporting the people who supported them through this. And I think what we may well see is a more caring society. I certainly hope that's the case.
Looking from the community in Scotland to the global policy, what at this stage can we identify as the great lessons from this global pandemic, and what changes are required at international level so that we are better prepared for the next challenge to come?
From my point of view, the main lesson is listen to the World Health Organization. These are people of immense experience. They get to see what's happening in different parts of the world very early on. And in this instance, they have been much more on the ball than individual countries like the UK, like, God help us, the USA, where things just seem to be spiralling out of control in parts of the USA. So I think we need to be working more closely together in an international basis. Yes, of course, political systems will differ in Switzerland and Germany and so on. Local areas have much more power than the national government in terms of health policy and so on. But it's really important to listen to what's happening in other places, look and see what's working, and get on and do it. We have messed about, I think, for too long in the UK, and you can see some impatience within the Scottish Government, because the Scottish Government has jumped in and moved things on a bit faster. The whole of the UK government should have been moving faster earlier. So the lesson is listen to what's happening, look at the technology that other places and systems that other places are using to control it, learn from them and implement as quickly as possible.
Harry Burns, for my bedtime reading in the last few days, I've been looking at how Scotland dealt with a smallpox outbreak in 1942. And what impressed me from the contemporary papers was the ruthlessness by which the public health officials traced and tracked down the outbreak in Glasgow, Fife and Edinburgh, identifying every single case and, as far as they could, every form of communication of the disease, and eradicated it within a matter of weeks. Are some of these tried and tested techniques of public health somehow being lost from those who are charged with that responsibility today? Or have governments become complacent that technology and drugs were always going to provide answers?
Yeah, I think there is unquestionably a level of complacency within the UK government. I've seen quotes from different official documents from February and so on that say, well, this is this illness is in the Far East. We weren't troubled much by MERS and so on. Therefore, it probably won't affect us. So there was unquestionably some complacency. The ruthlessness that you talk about, well, that's not very popular nowadays. Smallpox, a particularly horrible disease, probably easier to control than this because we know that a great many people will be carrying the disease and be capable of spreading it and will have very little symptoms, whereas smallpox, you certainly knew if you had it. It would have been a bit more difficult, but lockdown is quite ruthless. It just happened too late here, I think. But yeah, you're absolutely right. When it comes to something as bad as this, we need to find a way of tracking down who's got it and make sure that they are isolated. Otherwise, many, many people, tens, hundreds of thousands of people, are dying. And we do need to be aware of this. We do need to realise that if we continue to do what we've been doing, the way we're eating animals and exposing ourselves to viruses that the human immune system has not been exposed to in the past, we need to realise that this kind of thing is going to happen, and we need in future to be quite ruthless about tackling it.
Do you think that because of the experience in the Far East of SARS and other threatened viruses in relatively recent years, that policymakers in these countries, a variety of countries, and indeed health officials were trained in the importance of getting to grips with an infection and doing it quickly and early?
Yes, I think that's unquestionably the case with places like South Korea and so on. Undoubtedly, they were prepared for something like this to happen, and their system just swung into action. You saw within the first week or two all these testing stations with people in full PPE, swabbing throats and so on, whereas even now we are struggling to keep up. So they were prepared and they just got on and did it, and they controlled it and minimised the problem. So I would be very interested to know what, after SARS and MERS, what the conclusions were of the various groups in the UK that got together to discuss what a future governmental response should be. I don't know if we've ever seen any of these reports, but they must be there, and it would be very interesting to read them.
And finally, Harry, is there a case, looking at the pressure that's come to bear on the World Health Organization from a variety of sources, of moving their finance into some sort of dependable international basis? For example, a Tobin tax, perhaps, devoting some of the finance for an international tax on financial transactions, or some other means of putting that world specialty into a secure funding. Because if the world is a village in terms of the ability of a virus to communicate, then our World Health Organization should have the security and funding to be able to do the job on behalf of the planet.
Oh, I think there is no doubt about that. There is a big lesson being learned here about the importance of having a capable, respected international authority that will quickly get onto these things and quickly flag up for other countries what they need to be doing. So, yeah, they need funding. They do not need heads of state withdrawing funding just because they don't like the conclusions they're reaching, as we've seen on this occasion. They need the funding, but they need the support from the different countries, and that's support in terms of expertise and so on. I worked quite a lot with the World Health Organization when I was Chief Medical Officer in Scotland, and found them to be immensely reliable and capable. And indeed, I'm still in contact with some of them who just cannot believe the way the UK has delayed in getting to grips with this.
And Harry Burns, when you come back to, and it's safe to do so, to deliver a lecture to students or to a conference which is looking at the lessons of this outbreak, of this pandemic, what will be the first thing you say to that group of students?
If this happens again, test, trace and isolate. The single most important thing you can do when something as infectious as this emerges. Get on and do it fast. Just don't mess about. So First Minister says the other week that wearing masks will help, whereas the Secretary of State for Health in England says, oh, the evidence is very weak. Well, actually, the evidence is very strong that there is a weak effect. And that weak effect is an important part of the control. If I can just take a minute to tell you about a poster someone sent me from Spain. This poster is in 3 parts. The first part are 2 people talking to each other at close quarters, and one is infected, one is not infected, and they say the uninfected guy has a 90% chance of being infected in that situation. The second part of the poster, one guy with COVID, one guy without COVID. The guy without COVID is wearing a mask. What they say is the guy without COVID wearing the mask has a 70% chance of being infected. Less than the 90%, but still substantial. The third part of the poster, the guy with COVID is wearing the mask and the guy without COVID is not wearing a mask. And what they say is a guy without COVID not wearing a mask has a 5 to 10% chance of being infected. The mask works with people who are infected to stop them spreading it, not what is being suggested in England is, oh, you wear it to protect yourself. Now, the First Minister was absolutely correct in suggesting that in public transport and in shops and so on, as lockdown eases, the people with symptoms are the ones who should be wearing masks. Now, in England, they're saying, oh, the evidence is very weak. The evidence is there. And we know from the kind of improvement processes that we've had in the health service in Scotland over the past few years, that if you do lots of things that all have a small impact, added together, you have a big impact in controlling things. So it's that kind of open-mindedness and doing all the things that you think will work and doing them all consistently that will ultimately control outbreaks like this.
Harry Burns, in terms of the medium-term impact on people's mental health, of the strain, stress, tension, the grief, bereavement, and the extraordinary circumstances that we've been living through over these last 6 weeks, what approach can be taken to prepare ourselves for the mental health, the impact on mental health of the pandemic?
Well, that impact is happening now. Stresses and strains of not seeing your loved ones, stresses and strains of perhaps living in a difficult family situation, stresses and strains of impending poverty if you've lost a job and so on. All of that is out there, and therefore that makes it important that we move out of lockdown in a sensible and controlled way. There is no question that mental health will be damaged by what we're undergoing. You know, that plus the fact that lots of people are hanging on to physical ailments that they should be seeking use for. Those are the real reasons, the real health reasons for getting out of this as quickly as possible. But again, the stories I am hearing would suggest that there are really quite serious mental health problems happening. People feel at the end of their tether in the situations that they're in, and that will lead them, I think, to struggle, and regrettably, some will not make it through this. So yeah, we've got to move this as quickly as possible, but as quickly as is safely possible back to some degree of normality.
Professor Harry Burns from Glasgow, thank you very much indeed.
Thank you. Nice to talk to you.